Good day all, my name is Justin Perdun, and today I will be presenting a clinical case for APN 505, Applied Anatomy and Physiology. From the outset, we have a 32-year-old female admitted at 53.6 kilograms under her usual body weight of 61 kilograms and well under her ideal body weight of approximately 66 kilograms based on the Hamwe equation for her height of 175 centimeters. After the patient was admitted, she was diagnosed with hantavirus pulmonary syndrome and valley fever, as well as a small bowel obstruction second to ascariasis, which presented with abdominal distension and epigastric pain. Of note for the dietitian was the profound protein calorie malnutrition, um, that likely resulted from the symptoms accompanying the hantavirus diagnosis, namely poor appetite, nausea, vomiting, and diarrhea. The patient was admitted to the ICU with hypertension and pulmonary edema, which necessitated her being intubated and placed on mechanical ventilation, a nasogastric tube, and total parenteral nutrition. The imaging showed cords in the small intestine, with X-ray showing a gas buildup. The the ultrasound showing a lack of peristalsis, and the CT showing a mass in the distal jejunum and a thickening of the ileum that seemed to indicate tissue necrosis. During an exploratory laparotomy, it was confirmed that approximately 100 centimeters of the jejunum happened to be necrotic, and the mass was determined to be a bezoar, likely a result of the presence of the Ascaris roundworm. The bezoar was milled into the necrotic section of the jejunum, which had 100 centimeters of which removed, along with the entirety of the duodenum. Post-op, the patient recovered bowel function, and the patient was able to be extubated with their NG tube being pulled and their TPN discontinued. A peg was placed, but after speech language pathology determined the patient did not present with dysphagia, it too was able to be removed and the patient was able to be discharged. As stated before, the hantavirus diagnosis was accompanied with poor appetite, nausea, vomiting, abdominal pain, diarrhea, and a profound protein calorie malnutrition. As far as the patient assessment is concerned, the patient is vegan with a significant vitamin D and B12 deficiency, the former likely due to prolonged periods of no sunlight that accompany her career, as well as dietary shortcomings, and the latter likely attributable to a 70 centimeter ileal resection as a result of the patient's diagnosis of Crohn's disease earlier in her life. That would result in malabsorption of B12 as well as bile salts and fatty acids. The patient's lab results showed a higher than reference value of glucose as well as lower than normal reference values of creatinine, which the two would seem to confirm the patient's dehydrated. And labs also showed lower than reference values of both ALT and AST, which would seem to indicate stress on the patient's liver. The patient normally supplements vitamins B12 and D, but it would stand to reason that as a result of her lack of appetite and total intake altogether, these supplements were likely not being taken up until her hospitalization. She was also placed on omeprazole for gastric distress and was placed on the antidiarrheals of loperamide and cholestyramine. For the dietitian's purposes, the patient's diagnosis in the form of a PES statement is inadequate energy intake related to poor appetite, epigastric pain, vomiting, and profound protein calorie malnutrition, as evidenced by a 7.3 kilo weight loss over the last 3 months, as well as abnormal lab values for creatinine, glucose, albumin, ALT, and AST. This or inadequate protein energy intake can address the intake issues the patient is having, but there also exists a behavioral, environmental problem that can be stated of involuntary weight loss, but the etiology and symptoms for all three problems would be similar, if not outright the same. For our intervention, we will use a Vital AF 1.2 cal, as it is a peptide-based nutrition solution that specifically calls out impaired GI function as well as malabsorption, which our patient is currently experiencing. The protein content, 122.5 grams over the course of 24 hours, will account for her being underweight and facilitate injury repair. And the formula itself also accounts for aspirin recommendations of supplementing magnesium, sodium, potassium, and acetate for the GI loss and gastric distress that she experienced. The recommendation will be 68 milliliters per hour for 24 hours, starting with 20 milliliters for the first hour and titrating 10 to 20 milliliters every 4 hours until the optimal dosage is reached. That, in concert with a 250 milliliter free water flush every 4 hours, will help the patient reach her needed 1,800 milliliters of fluid. As the patient recovers, nutrition education will focus on how a significant portion of her small intestine was removed, and so she doesn't have as long of a GI tract to better digest larger portions of food or larger bits of chyme, so she will have to have smaller meals throughout the day that are well cooked and well chewed, as well as avoid thick skinned fruits and vegetables, as well as avoid high amounts of insoluble fiber, as these will lead to even further gastric distress. She will also need to ingest liquids 30 minutes either before or after eating in order to better facilitate motility, as the removal of the portions of small intestine would see less peristalsis and movement of food throughout the gastrointestinal tract. As her body heals, she will be recommended to avoid strenuous activity for the 2 months post operation, at which point she will revisit with the surgeon to determine the appropriate activity levels going forward as they pertain to both her career and her extracurricular activities that she enjoys doing, such as mountain climbing. Concisely, despite the patient's severe diagnosis, surgical and nutrition interventions will see her return to her ideal body weight and be able to return to some, if not most, of the activities she encounters in both her career and downtime. She says she should see some impact to her activities and a significant impact to her diet going forward, but nothing that it's unmanageable. So, thank you very much for your time, and I appreciate your consideration.